Bismillahirrahmanirrahim and Assalamu alaikum. Dear students, our today's lesson is related to the kidney failure or the renal failure. This topic is from your chapter homeostasis. In this topic we will discuss that what is the renal failure and what are its types. So first of all we will define that what is the renal failure actually. The renal failure is defined as the significant loss of the renal function in both kidney to the point where less than 10 to 20% of the normal glomerular filtration remains. The renal failure may occur as an acute and rapidly progressing process or may present as a chronic form in which there is a progressive loss of the renal function over a number of years. So we can say that the renal failure has two types. One is called the acute renal failure and second form is called the chronic renal failure. The onset of the symptoms of the acute renal failure are abrupt and rapid, while the onset of the symptoms of the chronic renal failure are progressive and slow. So the acute renal failure has an abrupt onset and is potentially reversible. That means it can be curable, while the chronic failure progressive slowly and over at least 3 months and can lead to the permanent renal failure. So in the simple words we can say that the chronic renal failure is not reversible and it can lead to the permanent renal damage. Next we will see that what is the pathophysiology of the renal failure. It means that what are the physiological conditions of the kidney which lead to its failure. So in renal failure there is either glomerular or the tubular dysfunctions. You know that the glomerular and the tubular both are the components of the nephron which are the structural as well as the functional unit of the kidney. For example, the glomerulonephritis primarily causes the glomerular damage. This glomerulonephritis is actually the inflammation or the infection of the glomeruli, and glomeruli, you know, these are the filtering units of the nephron. So next is the aminoglycoside nephrotoxicity is the mainly in the tubular region. So these are the two main reasons or the two main conditions of the kidney which lead to the renal failure. First of all, we will see the detail of the glomerular dysfunction, as the main function of the glomeruli is the filtration. The glomerular dysfunction leads to the fall in the glomerulus filtration process with the retention of those substances usually cleared by the filtration, including the water. So these all substances which has to eliminate by the filtration process and which has to become the part of the urine and now will remain in the blood, including the water. So next dysfunction is related to the tubular region, as the main function of the tubules is the reabsorption. So the tubule failure results in the voiding of the large volumes of the dilute urine, and condition is called the polyuria of the low specific gravity along with the electrolytes and the nutrients. So whenever there is a dysfunction of the tubular region, the reabsorption of the necessary substances, which includes the electrolytes and the other specific substances along with the water, will come into the urine and will not reabsorb by the blood. So first of all, there is the first type of the renal failure, that is called the acute renal failure. Sudden decrease in the renal function is called the acute renal failure. Acute renal failure may be pre-renal, intrarenal or the post-renal in nature. Acute renal failure is often reversible so long as the permanent injury to the kidney has not occurred. So its condition could be curable. What are the causes of the acute renal failure? This is the myocardial infarction, that is the death of the heart muscles actually. Next is the rhabdomyolysis. Rhabdomyolysis actually is a condition in which the breakdown of the muscle tissues are occurring that leads to the release of the muscle fiber content into the blood, and these are the harmful substances which cause damage to the kidney. And other causes includes the decreased blood pressure or blood flow due to any obstruction in the vessels or the arteries leading to the kidney. Next is Next cause includes the hemolytic uremic syndrome. What is the hemolytic uremic syndrome? It's a condition in which the small blood vessels in the kidney become damaged or inflamed and forms the clots in the filtering units, which is called the glomerulonephritis. Next is the common cause of the acute. These all are the common causes of the acute renal failure. So the acute renal failure classified as the pre-renal failure, intrarenal failure, or the post-renal failure. Next we will see what are the symptoms of the acute renal failure. That is the decreased kidney function, electrolyte imbalances, obstructions in the urinary tract. It could be the blood in the urine, reduced urine output, dehydration, detectable abnormal mass, pale skin, and the poor appetite. These all are the symptoms of the acute renal failure. And the diagnosis includes the routine laboratory test, which is the creatinine and the blood urea nitrogen. What is the creatinine? This is a chemical compound which is produced in the metabolism of the creatines and is excreted into the urine. And what are the creatines? This is a compound formed in the metabolism. So on the basis of the levels of the creatinine in the urine, we can find out the output of the kidney. Next is the ultrasound of the kidney helps to determine whether the kidney problem is acute or the chronic. Ultrasound is in ultrasound we can produce an image on the computer, and by watching its image we can find out any you can say the physiological impairment in the kidney. Next is the kidney biopsy. And what is the biopsy? This is a process which involves the extraction of the which involves actually the extraction of the sample cells or the tissues for the examination to determine the presence or the extent of the diseases. So another kind of the test which can diagnose the kidney failure is the computed tomography scan, which is called the CT scan of the you can say the organs, and the CT scan is giving the detailed image of the organs for finding their impairments. Next, we will see what kind of treatments can be offered in case of the acute renal failure. So the prevention of the acute renal failure through the support of the blood pressure and the blood volume, correction of the fluid and the electrolyte imbalances. Next is the dialysis, which may be employed while the kidneys are in the recovery phase. So until the kidneys are recovering, the dialysis could be offered to the patients for the short while, and as soon as the patients are recovered, the dialysis can be stopped. So the low protein and high carbohydrate diet to minimize the formation of the nitrogenous waste. Next, we will see the definition of the chronic renal failure. This is the second type of the kidney failure. The chronic renal failure is the end result of the progressive kidney damage and the loss of the function. Chronic renal failure is often classified into the 4 progressive stages based upon the loss of the glomerulus filtration processes. What are the causes of the chronic renal failure? This could be the chronic glomerulonephritis, which is again the inflammation of the glomeruli filtering units. It could be the chronic infections which can lead to the kidney damage, renal obstructions, which could be the prolonged type, then the exposure to the toxic chemicals like the toxins or the drugs, and the diabetes could be another cause of the chronic renal failure, hypertension, and the nephrosclerosis. Nephrosclerosis is actually the atherosclerosis of the renal artery. And what is the atherosclerosis? This is the deposition of the fatty materials in any vessel. When this deposition is occurring into the renal artery, this could be called the nephrosclerosis, which cause the obstruction or the resistance of the blood flow to the kidney, and it will reduce the supply of the blood to the kidney, which can cause the damage to their filtering units or the nephrons, and it lead to the permanent kidney impairment. Next is the diabetic nephropathy. And what is the diabetic nephropathy? It is the kidney damage due to the diabetes. the damaged filters become leaky and lets the protein in the urine. So this is the result of the diabetic nephropathy. Next is another kind of syndrome can cause the chronic kidney failure, which is called the Alport syndrome. It is inherited disorder caused deafness, progressive kidney damage, and the eye defects. Next is the polycystic kidney disease. What is the polycystic kidney disease? It is the production of the non-cancerous cyst. What are the cysts? These are the fluid filled cavities in the kidneys, leading to the loss of function over the time. And the interstitial nephritis could be another cause of the chronic renal failure. And what is the interstitial nephritis? In this disease, the spaces between the tubules become inflamed, which are you can say reduce the kidney's ability to filtrate properly. So these are the different causes or the conditions which can lead to the chronic or the permanent renal failure. Now here we will see that what are the symptoms of the chronic renal failure. This could be until very kidney functions remains, the chronic renal failure may not develop. So anemia, increased level of the phosphates are the complications of the kidney failure. Malaise, dry skin, poor appetite, vomiting, bone pain, metallic taste in the mouth, and detectable abdominal mass. What is the metallic taste? This taste could be felt in the last part of the throat, and this could be the one of the reason of the chronic renal failure. Next, we will discuss the treatment of the chronic renal failure, the careful management of the fluids and the electrolytes, prudent use of the diuretics. Diuretics, what are the diuretics? These are actually the drugs that promoting the urine production, thus lowering the blood pressure. So this could help the patients of the kidney failure. And the careful dietary management, restriction of the dietary protein intake, which can cause the production of the nitrogenous waste. Then is the recombinant erythropoietin to treat the anemia. What is the erythropoietin? It's a substance that is naturally produced by the kidney, which stimulates the bone marrow to make the red blood cells. So this can replenish the anemic conditions. And the renal dialysis, which is another process which is in the artificial you can say filtration of the blood by using a dialyzer or the machine. And next is the renal transplantation. This renal transplantation is the replacement of the diseased kidney with the help of with the healthy kidney from a donor which is healthy and have both functional kidneys. So this is the treatment of the chronic renal failure. So this is all about the kidney failure and its types. Thank you and Allah Hafiz.